I'm very proud and happy to introduce you to Dr. Matt Cook. What do you recommend to have to be able to have the rest and relax be more in tune with keeping your body healthy? I mean, like, how do you get the brain, the vagus nerve, and all of those organs to function more healthfully? So, because I would imagine that puts a lot of stress on your global health.
Okay, I think that's probably the second best question you could have possibly asked.
Doctor.
I think in my next life or in my next incarnation, I'm going to be a comedian, I think. So then it's different for every person depending on what that stress is. So as COVID, now the first thing that I try to do is that everything that is a trigger, whether it be emotional or physical or spiritual or energetic or all of these things, anytime there's a trigger, if we can create sort of like a model of life and what's happening to us and what triggers us, and then we can start to downregulate those triggers and reset those triggers emotionally or in whatever category it is, then that's going to be helpful. So for example, if you were super stressed about COVID, but then all of a sudden you found a whole bunch of things that you could do to reset yourself, and you found a whole bunch of things that you could do if anything horrible went wrong. And so then you started to feel like, oh, okay, I have a plan and an algorithm that might lower your stress and allow you to kind of reset. If you were a victim of sexual trauma and you felt like you were never going to be safe, but then you started to have some safe relationships and started to learn boundaries, and you started to learn how to manage that. And as you did that, all of a sudden you started to realize, oh, okay, I have got these people that I can do this, and it's safe, and it's not safe for me to go to that place or deal with those people. And so then your boundaries are getting better. All of a sudden now because at every millisecond, your brain is sensing, is this fight or flight, or is everything cool? And so what I'm trying to do is build more time in your timeline that says everything's cool. And so then sometimes that I do that through talking. And I think that's in certain ways, when people begin to see, oh, there's an algorithm where I can start to follow that will be helpful. Everything that you've ever heard of that as being good promotes a balance between fight or flight and rest and relax. So heart rate variability, the better that is, the better you switch back and forth. So mindfulness, meditation, breathing, pranayama, all of those things, yoga, qigong, tai chi, that we've spent sort of a ton of time, we realize all of that is modulating and managing our response to the world of what's coming into us. And so then I do an injection that literally turns the fight or flight nervous system off for like 8 hours. And then when I do that, now all of a sudden imagine now I don't have anger or fear to be able to respond. And so then that forces my brain to use other parts, the rest and relax part of the brain.
What is that injection?
that injection is called the stellate ganglion block. And so we will do that. Sometimes I'll do something called a vagus nerve hydrodissection, where I'll put growth factors around the vagus nerve to try to reset it. And then the thing that you may have heard about that's potentially the most interesting, just because it's relatively easy to do, is we will give patients anesthesia drugs from my anesthesia background called ketamine. And ketamine kind of is disassociative, so it kind of disassociates us from our emotional triggers. And then it helps us kind of reform and recreate our relationship with triggers. And then it makes people feel mildly psychedelic and often very safe. And a lot of times if I could just give you an amazing feeling that you 100% remember, and then you come to a realization, you go, I think I'm gonna be okay. That is extremely powerful, because then tomorrow you go back to that feeling that you had today, and then you realize, okay, this is not the end of the world. We're gonna be okay, so we can kind of manage and reset that.
And is this in considered microdosing?
Oh, so then that's a good question. If you want, I will tell you about that. Um, the the there's a whole bunch of work in the PTSD trauma spectrum that's being done.
I like that we're going here, because there's a lot of people out there that are very fearful, and this pandemic has actually triggered a lot of out of control, repressed fear that's coming up. So this will be interesting to a lot of people out there.
Okay, this could be good. So within that, one thing that I could do is just turn off fight or flight and see what happens. Okay. Another thing that I could do is use a drug like ketamine. And now with ketamine, I can go very low dose, medium dose, which would be very low dose, would be like a microdose. I can go to a medium dose, and I do a medium dose a lot, where I will give somebody that and I'll talk to them. So I'll just have kind of a therapeutic conversation. Sometimes that's better than a high dose. Okay, and then sometimes I will do a medium, high dose, and sometimes I'll do a high dose. So then within ketamine, I have all of those doses, and so we can go into that.
And does a single treatment make a difference in most patients for breaking the cycle?
So it's all over the map. So there's a whole bunch of trials that were done looking at ketamine for drug-resistant depression. Now, the great thing is, drug-resistant depression is really hard to treat, and ketamine seems to help many of those patients. And in that model, what they did is they did 6 treatments. And so they would do either 1 treatment a week or 1 or 2 treatments a week for 3 to 6 weeks. Now, what I have evolved into doing is my area that I have a lot of expertise in is IV therapy. And so I will do IVs, but I will put a whole bunch of different things that help mitochondria work better and turn inflammation off in the body. And so then I will combine all of those things.
Is glutathione one of those things?
Yes. Yeah, that's really good. So then I will do all of that stuff, and then I will combine it with ketamine. And when I do that, I find ketamine works about 50% better. Sometimes I'll do ketamine, and it's just like a one and done. I'll do it, and then people will. I had a wonderful woman who was a therapist who had been basically in pain for like 30 years. And then because of something horrible that happened. And so then it was amazing, because we did that conversation, and then she came to the realization that it wasn't her fault, and she was like a great human being, which she was. And what happens is, a lot of times internally, I'm kind of having this conversation like, maybe I'm a great human being, but maybe I'm not. And so then all of a sudden on ketamine, you go, oh, I actually am a really good person. And so then once you come to that realization, sometimes people will get that realization and then it's done. Some people, there was 10 things going on, and it takes a little bit of time to work their way through all of those things. And then sometimes I'll do everything that I have. I'd like to do the least amount of things and whatever is going to be most effective. And so I'll work my way through. But then this third category is a super off-label category, but I think is going to be a normal therapy in the future, which is microdosing, which you mentioned. And so there is an organization called MAPS, M-A-P-S, and what they are doing is they're doing clinical trials on people with PTSD. And they are looking at what used to be and still is a party drug called MDMA. And so they're studying that drug because it seems to be incredibly helpful for people with PTSD, and I can kind of tell you why. And then there are a whole bunch of patients, and I was not really aware of this personally, but then what happened is I just started having patients coming in, hey, what about this? Like, do you microdose? And I was like, no. And they were like, I was like, what is it? And so then they started telling me about it, but because I'm an anesthesiologist, I'm interested in dosing and stuff like that. So I started to dive into this. And the two main substances that people use for microdosing are either psilocybin, which is the magic mushrooms, and then LSD. And so if you imagine that LSD, the dose of a treatment is like 100 micrograms of a full dose, but that lasts for about 16 or 17 hours. Okay. The microdose is somewhere between 2.5 and 10. So it's 1/10 of a normal dose. And many people at the low end don't feel anything, but then they start to feel better. And so there's an entire world of people that are doing that. And obviously that's totally legal, but I'm just aware of it because a lot of people come and ask me about it. And then for magic mushrooms, when people take magic mushrooms, they'll typically take like 1 to 3 grams. Okay. And so then if 1 gram was a normal dose, people will do a micro dose of 1/10 of that. And so like 100 milligrams is 1/10 of a gram. 1,000 milligrams is 1 gram. And so then there are a lot of people who will play with those. Now, if you say, let's get in our time machine and fast forward to 2030, I predict that microdosing with all of those things is going to be a relatively vanilla, normal therapy for patients in 1/3 of the developed world. Okay, it's going to be something that people are going to start to do, and they're going to find out that it's effective. Because what happens is, I don't know if you've ever seen a picture of a neuron where there's a neuron and it makes neurotransmitters that gets released, and then it goes over to stimulate another neuron. So neurotransmitters are how you communicate from one neuron to the next. Now, what happens is all of the psychiatric drugs try to boost up serotonin to get it to stay in there longer. But then the body goes, I don't know about that. And so the body starts to compensate for that. And then what happens is people tend to get numb and they have all kinds of side effects from that. The things that we're talking about that microdose tend to be presynaptic. And so what they do is they stimulate the neuron to create a big boost, and then it goes away. So it's kind of in this, it's anything that is good at any level, anywhere in society or culture, is more likely to do a reboot than to just optimize your levels. Because if you optimize levels in the cleft, the body's just going to try to overcome that.
Or become dependent rather than just wake up.
Right.
And, start like shifting into high gear on its own.
That's right. And so that's why on the one end of the spectrum are all these things that are reboots and resets. On the other end of the spectrum is drugs that are amazing at managing symptoms, but then are super non-helpful and non-constructive, like benzodiazepines, which make anxiety disappear, but then it comes back worse, or opioids, which make pain go away, but then it's going to come back. It comes back with a vengeance.
Yeah, that's why, we have to look for alternative practices so that we're not dependent on those crazy powerful prescriptive drugs that have already proved to be, in the short term, helpful, in the long term, lethal.
Yeah, it's interesting. It's interesting, Fran, because I I I just thought of this just now for the first time. This is hilarious. For 15 years, I gave a benzodiazepine and an opioid to every single patient that I had. 'Cause I was an anesthesiologist, so every single person got those two drugs, just about. And so then now it's interesting because I do a lot of pain management, and I never prescribe opioids. Like I have like and it's I have and what someone told me, and this is so interesting about how you approach life. Somebody told me, and I remember I was just kind of walking around feeling good and normal. And then this guy goes, here's the thing, you have to walk through your life and then pay attention to every minute of your life. And he goes, and there's a whole bunch of things that everyone's doing right now, and that they're totally dysfunctional and they don't work. But everyone's hypnotized to it, and no one knows what those things are because they're just thinking that everything that they're doing is the standard of care. And so then what you have to do is you have to figure out what those things are and then figure out an alternative. And so then I thought this is the greatest thing that anyone's told me because he just told me the secret of life. And so then I literally spent all day, every day with that in the back of my mind. And then I became really fearful in like the last 4 or 5 years of my career because I thought, I may not find a solution to this stuff and I may be totally screwed, you know. And then it was like I kept trying, and this is like this is on the medical side. I kept trying and trying and trying. I like went to a medical meeting probably 30 or 40 weekends a year, trying to kind of put all this stuff together. And then I just kind of saw it all, and I realized we have way more power to kind of manage all of this stuff and reset our bodies and our immune systems because they follow the same rules the computers and everything else in the universe follows. And
Right.
so we're just trying to get it dialed in.
Well, this is what makes it so exciting for me to speak to doctors like yourself, because all of them went to medical school, drank the Kool-Aid, started practicing, believed they were doing the right thing, following the status quo. But then something about individuals like yourself began to question, is this the right path? Is this all there is? Is there a better way? Are there better practices and protocols? And these are the pioneers like yourself who are part of integrative medicine, functional medicine, looking at the whole body as a system and finding new ways to deal with problems that incorporate mind, body, and spirit, which is so important to find the harmony for. So
Now, can I weigh in on COVID for just a
sure.
second? Okay. This I don't want the people to think that I'm making claims. I'm just trying to talk physiologically about my thoughts about COVID. And I want to put together a number of things for you to think about and for people to think about as they strategize what's happening with this.
Okay.
Stage 1 with COVID, it can get into your nose, it can get into your throat. And we know about this, and people get fevers because the body's trying to heat itself up to fight the infection. Stage 2, what it can do is go down and get into the pneumonia, or you can start to get a gastrointestinal thing. I personally think all the people that get gastrointestinal are because they already had something else going on there. Parasites, small intestinal bacterial overgrowth, leaky gut, many of the things that we talked about. What happens is once it's in the lungs, it's a short skip and a jump to jump into the blood vessel. Those are the people that get this thing called sepsis. And then what happens is it floats around and it can go to wherever the blood goes. So it can go to the kidney, it can go to the heart and look kind of like a heart attack. Then it can cause clots on the lungs, and it can cause clots in the brain. Now, what I think is going on is that it acts on a receptor called the ACE receptor, And that receptor is in the lining of the blood vessel, the lining of your intestine, and then it's in the lining of your airway. And so it can go in any one of those cases. If you looked at what happened, there's a big political catastrophe of what happened on the USS Roosevelt, the aircraft carrier. They had hundreds of cases, and then they took and quarantined a bunch of people. They quarantined them, and they were negative. And then all of a sudden, they retested as positive after 2 negative tests, and so they had to be re-quarantined. What I think is going to happen is that there's a cohort of people that have it, and it gets systemic. Mm-hmm. Those people can have relapses. So we are going to have, over the next year, some people that have a relapse and some people that have new infections. And so that's very important, because the relapse is going to behave a little bit like Lyme, okay? Now, of everything, I think that the most effective therapy, if we go back in my time machine to 2030, I bet we're going to look back and we're going to find out that the most effective thing is ozone. Now, ozone is incredibly off-label. The FDA doesn't really want to talk about it. They're not regulating it, so it's non-regulated in any way, shape, or form. But there are European techniques where you take blood out of a vein and then pull it into a machine and mix it with oxygen and ozone. And ozone oxidizes and kills viruses. And so then when you put that back in, it's like you're putting an antibiotic in the bloodstream. So we're doing that, and we're doing intravenous quercetin and oleuropein, which is an olive-based antibiotic, but these are natural antibiotics that have been shown to have an effect against coronaviruses. So what I'm not treating anyone
as an antibiotic, because it's not a bacterial thing, it's viral. Is that to try and heal what else is going on, so you don't go into that cytokine
right, the cytokine storm? So that's the third best question of all time. So so then everything is designed around calming everything down over here, and then doing things that have an antiviral effect over here that are different. Okay, antiviral, antibiotic. And so I think ozone, number one, oleuropein and quercetin, vitamin C, and glutathione. And the glutathione you can nebulize, or you can do it intravenously. Mm-hmm. Okay? So all of that is quite amazing. There's something that's kind of like a stem cell treatment that's extremely anti-inflammatory. These are called exosomes, and they're wildly off-label. But I predict in 2030, when we look back at this, we're going to see that that's something that has some antiviral effects, but seems to really calm down inflammation, which is what you just mentioned. And then there's a therapy called peptide therapy, where we do a peptide, which is a little protein that's inside the body that stimulates your immune system and helps your killer cells fight infections. And so in our trials, we're trying to look at a combination of all of those things. And then there are some other peptides that are kind of anti-inflammatory. Then the ones that I'm thinking about are one called BPC-157, thymosin beta-4, and thymosin alpha-1, but there are more. And so then my concept is, once you put all of those together, and then you reset, rest and relax, fight or flight, start feeling better, figure out what's going on in the gut and reset that and get your health better. And then look, is there any other big trigger that's affecting health? Reset all of that stuff. And then be dialed in, so that then when you face that, you are totally prepared to deal with that. And then we need to get some clinical results from treating that. We treated a whole bunch of people that had pneumonia in January and February. We're not treating this until our trials get approved now, because I don't want to be trying to promote something that's quote unquote unproven. But I treat people with chronic infections all day, every day. So I'm just getting this out there, and then we'll hopefully do a podcast before 2030, but then we'll start to look at this stuff and track and see how it goes.
Well, I cannot thank you enough. I could listen to you all day, and I think that I'm going to have to fly up and come see you.
Oh, good. Yeah, I would love
I'm
that.
going to call you. I'm going to talk to you more about other things that are personal to me and my family. But I thank you so much, Doctor. You're absolutely wonderful, and I'm thrilled to make your acquaintance and get to talk to you. I think that everything that you're saying is spot on. It's absolutely where we need to be going. And I'm just grateful that, you are a pioneer, and I, I'm able to present you to the world. So thank you so much. I wish you good health and long life. So once again, to our viewers, please go to BioResetMedical.com and also listen to Dr. Cook on his podcast. I'm going to sign up for it as well at BioResetPodcast.com. And thank you all for tuning in to Corona Care for You. We are here for you through Cancer Schmancer. This is a time of confusion and fear, and we want to allay those with some practical solutions. You are in control of your body, so use this time to repair it, reset it, and get healthy so that we're prepared for the next eventuality. We really have to change our lives. We have to change our eating. We have to change the way we disrespect the planet, because that's the reason why we're having this virus pandemic. And until we really look at causation, we're just going to be chasing our tails. So God bless all of you. Be well, long life, and think peace. Thank you so much. Hi, everyone. It's me, Fran Drescher. Well, I hope you enjoyed Corona Care for You. And if you did, please think about making a donation to us at cancerschmancer.org/donate. Like so many nonprofits, we've had to cancel all of our fundraising events. So it's really up to you to help keep us going. We depend on your donations, your support, and your love. There is no donation that's too small, and we are grateful to anything that you feel comfortable giving. And continue to come in to the Cancer Schmancer Corona Care for You series, because we are constantly posting new content, and we hope that it's helpful to you and your family. Don't forget to donate. We really appreciate your support. Thank you.